Deal is done. Belle Isle will officially become the 102nd state park in Michigan. The state lease saves the city millions of dollars a year, but now it's time to see exactly what and how the state will invest in the site. They are already in the middle of that 90-day assessment. So let me ask you, I'll start with you, Steve. What does the state have to prove here? Do they have to prove anything?
Well, I mean, they got to prove they can manage the island better, but that's a pretty low bar, isn't it? You know, I live really close to the island. I spend a lot of time out there. It's a mess. You know, you've got bathrooms that don't work. You have flooding all over the place. And that's not to say anything about the lack of programming. You know, Belle Isle should be full of kids every day in the summer out there doing things that like it was when I was a kid. We don't have money to even run those programs anymore. And so I think the state, if they wanted, could really make that into a destination for people all over Michigan to take their kids, to take their families and have a good time. But I think, again, the bar here is low. I mean, if you just take care of it, you're doing better.
You've already gone ahead.
They got to do more than that. I mean, they took this over. This was a big move, a big play. If it's a year from now, as messed up as it is now, people aren't seeing progress. They're not seeing buildings getting fixed. They're not seeing fun things happening on that island. They're not seeing the stinking geese cleared out and all that mess.
I don't know how you get rid of the
Nolan's
geese.
private axe grind.
You turn people loose with shotguns and say, "Have at 'em, boys."
Wow.
But
So now we're
yeah,
gonna
you can't
shoot
do
up on
that,
Belle Isle.
by the way.
you sure can. But anyway, if people a year from now look at Belle Isle and say, "Well, I don't see the difference," that's going to come back to bite the governor in the butt. He's got to do big things there.
All right, and we'll be watching and waiting to see. Well, you know, just under 27,000 people were able to sign up for Obamacare all last month on healthcare.gov, which shows the administration has a big problem. Another 79,000 signed up with state exchanges, but Michigan doesn't have one. We're in the federal system. And as the government scrambles to fix the website, they're sending Secretary Kathleen Sibelius, who has been in the line of fire over Obamacare, over the rollout, to Michigan tomorrow. Okay, Nolan, so what does Kathleen Sibelius say tomorrow? What can she say here in Michigan?
I quit, and I think people would be, it's the only thing that's going to make people happy.
All right, she's not going to say that.
No, but look, this thing is just an absolute mess. You have even Democrats now lining up outside the White House saying, man, something's got to happen or we're going to get slaughtered next year's elections. Bill Clinton saying, man, you got to keep your promise. You made a promise, American people. You can't now spin. You got to keep your promise. Problem is, you can't keep that promise because it's too far down the road. 2.5 years, insurance companies have been working frantically and spending billions of dollars to rework insurance systems. You know, Republicans say repeal. You can't repeal it now. You would throw the whole system into chaos. The whole system would collapse. But Christy, this is the biggest attack on the middle class we've ever seen in America, because now you're going to have families who are just barely getting by, trying to save for college, trying to pay their mortgage, and they're going to have medical bills, in a lot of cases, an extra 10 grand a year because of the way employers are having to change policies. Only the poor and the rich will be able to afford to have babies. Can you imagine a young couple coming home from the hospital with a baby and a $10,000 bill?
Well, I mean, I think this is going to have to play out now over the next couple of months. But let me ask you this, Steve: why Michigan? Why are they coming to Michigan now?
Well, I mean, that's a good question. I'm not sure. I'm not sure I would have sent her here, given the problems that we've had. And let's be clear about what some of the problems that we have in Michigan are about. We have a legislature that waited a long time to even pass the exchange and the Medicaid expansion, and that's why we don't have a website in Michigan right now. So you have to go on healthcare.gov. That's one of the big problems, is that you have these states where you would have lots and lots of people participating. Texas is a great example. Texas has something like 4 million uninsured people who would qualify to get on Medicaid.
So what message are they?
They won't do it.
Hang on. What message are they hoping to send by coming to Michigan, though? By sending Kathleen here?
I think the strategy here is a disaster. I mean, this is not a PR problem. It is a functionality problem, and it's a political problem for the president, right? I mean, you've got to make this system work, especially in the early going, because all of the benefits of this reform come down the road, 5, 10, 15 years down the road, when the fact that you have fewer people without insurance lowers the costs for everybody. That was the theory behind the whole thing. And if you can't get it up and running early,
You can't get a line to figure out what even you're looking at.
If
That's
your
a problem.
early
We're gonna have a big
promises,
problem.
if your early promises aren't working, your long-term promises aren't going to either. The problem is
but
not
Medicare
that
Part
people
D had the
can't
same
sign on
problem.
to exchanges.
It
The
is one of the
problem is that the great swath of America who were told this is not going to impact your insurance, you're going to be okay when this is done, are now seeing insurance changes, insurance policies coming through the mail that they're not going to be able to afford. This was supposed to make America healthier. How on earth is it's going to make America healthier if you can't afford, because of your copays and deductibles, to go to the doctors for the test
but
and
those
procedures
talking
you
points,
need?
those are
Last
great,
30 seconds,
those are
Stephen, you
great
get the last
talking
word.
points. Here are the plans that are being eliminated. The plans that are being eliminated didn't cover the things that were driving costs up in the system. And so getting rid of them and forcing people to get on plans that actually cover things and cost more. I mean, the idea is you got to pay for this stuff and pay for it up front instead of in the emergency rooms. And in the long run, it will lower costs.
How many families are going to be able to afford 10 grand a year?
And they have to get that website up and running so people can even see what
absolutely do.
the information. All right, guys, thanks so much. Before we end tonight, just a quick invitation to let your voice be heard when it comes to the direction that Michigan is headed. We're teaming up with the Center for Michigan for a community conversation next Wednesday, November 20th. I'll be moderating the discussion in Detroit. Tell us what you think about the state's economy, education, and future. Just go to MiWeek.org to find out all of the details. And that is going to do it for MiWeek. Thanks so much for joining us. Don't forget, we're on Facebook, we're on Twitter at MiWeek. For all of us at Detroit Public TV, for Nolan, for Stephen, I'm Christy McDonald. We'll see you next week.